Welcome everyone to the webinar today, Harnessing Community Organizing to Enact Alcohol Policies with Tracy Toomey. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. The PTTC believes that words matter and uses affirming language in all activities. A few housekeeping items. Technical issues, if you're having any problems, please individually message Rebecca Buller, me, or Jen Winslow in the chat at the bottom of your screen, and we will be happy to assist you. If captions or live transcript would be helpful, please use your Zoom toolbar near the bottom of your screen to enable by going into the More section, then select Captions, then select Show Captions. Questions for the speakers should be put into the Q&A section, also at the bottom of your screen. That really helps us keep track of the questions. Sometimes when they're in the chat scrolls by so quickly that we might miss your question, and we don't want to do that. You will be directed to a link for a short survey at the end of the presentation, and we would really appreciate it if you could fill it out. It takes only about 3 minutes. Certificates of attendance will be sent out via email to all who attended the full session, and it can take up to 2 weeks to receive those certificates. Let us know if you don't, but also check your spam or junk folder. Sometimes we've heard that they go there. If you'd like to know more about what we're doing or information on upcoming events, please see our social media pages. And now I'd like to introduce Tracy Toomey. She's a professor at the School of Public Health and serves as the director of the Alcohol Epidemiology program at the University of Minnesota. Her research focuses on the prevention of problems related to use of substances, including alcohol, tobacco, and marijuana. Much of her research has addressed underage alcohol use and overservice of alcohol. Dr. Toomey earned her PhD in epidemiology from the University of Minnesota, and I'll turn things over to her.
Thank you, Rebecca. I'm really pleased to be here again this week to talk about community organizing. And the title is Harnessing Community Organizing to Enact Alcohol Policies. But really, what we'll be talking about today is really relevant to doing work in a variety of different public health areas. My example will be from the alcohol field, but I hope that you'll see that there's application for your work outside of alcohol control if you're working in other areas as well. So I'm going to share my slides and get us going. This, I have to say, is one of my favorite presentations to give. I give this presentation in one of my classes every year, and I also am a guest speaker often in another class and talk about community organizing. It's something that I learned about when I was a student, and many of my friends are community organizers, and it's just, I think, such an important part of the work that we can, or important tool or method that we can use in public health to affect real change. Along the way today, if you have questions, feel free to put it into the Q&A and stop me, and I'm happy to answer questions as we go along. So in public health, our goal ultimately is to improve health. And if we were all in person, I would just be like, well, how many of us went into the work that we did and to get nothing done, to improve no one's health? And of course, no one would raise their hands. I mean, we all put a lot of effort and time and a lot of ourselves into trying to improve our communities, improve the health of people in our states and in our country and broader. And so we really want to think about how are we going to have the most likely to have the effects that we hope to see in terms of health improvements. Those of you that maybe saw me present last week or the week before will recognize a theme here in that I really believe that if we're going to create population levels of change and really change rates of problems in our communities and our states, that we really have to change the broader environment that contributes to alcohol use or problematic alcohol use or any other types of behaviors or problems that we're maybe addressing as public health workers. And to change that environment, whether it's access to a product or access to healthcare, really we have to think about changing policies. And policies are typically, when we think about policy, we're thinking about a formal government body like a city council or state legislature or Congress, but it also can be at an institutional level, and we'll talk more about that. And once we get policies in place on the books in terms of like statutory language or an ordinance, we have to remember that there's also regulations. So the bureaucracies, whether it's working with health departments or the Department of Public Safety, that some of these agencies are designed to implement the policies, and we can look at what's happening at that implementation stage and work to create changes that are going to be more likely to be effective at that level as well. We also have to make sure that there's enforcement, and whether it's law enforcement or licensing or some other body that has the authority to apply some type of consequence for lack of compliance with the policy or in some type of incentive to promote the likelihood that people will comply with a policy. And then we can do things like just improving the physical environment. So if we think outside of alcohol control, it could be doing work to make sure that our playgrounds are as safe as possible for kids, so that we decrease the likelihood of injuries occurring. So there's a lot of work that we can do that requires changing decisions that are being made in our communities and our states, that require kind of key decision makers to maybe give resources towards doing something, or again, put some type of barrier or control in place. I've already made this point a couple times that the level of change can happen at the federal level, state level, local level, and institutional level. So institutional levels, I'd just like to emphasize this, it can be schools, universities, work sites. I'm going to use the example of community festivals later in this presentation, and that could be institutional policy change as well. And as I said, with implementation, we want to make sure that people are aware that the policy exists and that it's enforced. And so when we're thinking about creating the changes, I just emphasize this because so often historically, so much work has been put into getting the policy passed, and then we kind of think we're done, and then no one's aware of the policy, no one faces consequences for lack of compliance, and so it's a policy on the books, but it's really not a policy in practice. And so we always want to make sure that we continue to do the advocacy work to get policies in place, but then also to make sure they're fully implemented afterwards. So as we identify these changes in the environment, whether it's policies or enforcement or some other type of implementation process, we have to think about, well, how are we going to make that happen? How are we going to influence the key decision makers to make the decision that we want them to make? And I've been doing some type of training related to community organizing for many, many years. And I can't tell you how many times I've been asked for the manual, or what's the curriculum for doing this type of advocacy work. And one of the challenges is that there are guidelines, there are stages of doing some of this work, there's trainings that are out there, but it isn't a curriculum in like a programmatic curriculum where it's you do this and then you do this and then you say this and you introduce the topic like this, because you really have to think about the strategies and the methods that are appropriate for wherever you're trying to create the change. So what might work at the University of Minnesota may not be the strategies that are needed or the same method that's going to be effective at Mankato, or what works in the city of Minneapolis in terms of specific strategies that are used may not work in St. Paul. So you have to think about the context in which you're doing this work. And again, there's some steps or stages and some methods and techniques that we use when we're doing advocacy work, some tools that we use, but you have to think strategically about when to use them and even what solutions that you're proposing, because it may vary again by the context in which you're doing the work. And I think it's really important as we think about doing advocacy work, whether it's community organizing or another type of advocacy, and I'm going to talk about those, but to recognize who's the best person to do that work. And I've seen over the years that sometimes we think it can just be somebody that has a little free time in their schedules, or a volunteer that maybe is interested in a particular topic. Those individuals may or may not be right. You have to think about the personality. You have to think about if they're strategic thinkers. So you need to think about, if we're trying to navigate a political climate, who's going to be comfortable working in this very political arena? And so some people are better at education, which is really important, and some people are going to be better kind of in this political climate. And so we have to think about ourselves. Am I the right person for it, or should I be hiring someone to do that? If we have a volunteer that has a lot of passion for a topic, but they're really interested in education, maybe we think about how to use their passion in a way that supports the policy work, and find those people, again, that think strategically and are comfortable with conflict and moving things forward. As we're thinking about making policy changes or enforcement changes, we have to think about the fact that policymakers and other key decision makers are influenced by many different individuals and entities. So certainly if they're elected officials, they're going to be influenced to a great degree by their constituents, particularly if they want to continue to be in office. So it's really important, if you're a constituent, that you let a decision maker know that you are their constituent when you're communicating with them, because that's influential, and or mobilizing other constituents to let a policymaker know of what's wanted. So that's part of that organizing, bringing together constituents to put pressure on a policymaker. We also know that money talks, and so donors certainly can have influence. And certainly if anyone that has financial resources can be an influencer by donating some level of money. Oftentimes in public health, that's not the strength that we bring. So we often are focusing on people power. How do we harness the power of a large number of people to put pressure on key decision makers versus money? But we have to acknowledge that there are individuals and entities out there that have more money, and they do have influence. We also know that there are special interest groups, including businesses, nonprofits. Some of you probably who are here today probably are part of nonprofits that are influential, or part of issue-oriented groups. So certainly, if I was on the board of directors of Mothers Against Drunk Driving, great example of a nonprofit organization that is issue-oriented, focused on drinking and driving, and they've been very, very influential and continue to be influential today. Sometimes policymakers and other key decision makers are influenced by a crisis. So I had a strategist that would come to my class a lot, and he would talk about the 35W bridge. When that collapsed, there was an incredible sense of urgency. We need to fix this main artery that's in the Twin Cities area that needs to be fixed. And so it was very quickly decided, that there's money available and making a decision about the contract and moving it forward. So if there's a crisis, that can make people make decisions more quickly and drive the direction of that decision. Relationships with lobbyists. Lobbyists can be very influential. And so in my class, I talk about, well, what is the image that people have of a lobbyist? And maybe in the chat or people could just kind of put, I can't see the chat, so maybe Alyssa, Rebecca, or Jen, one of you could read it, but just what are the words that come to mind when you think of a lobbyist?
This will be fun.
Yeah, just put in the chat. What comes to your mind if you think about who's a lobbyist and what
A
are they like?
lawyer, money, smooth talker, somebody from alcohol industry, informed, big interest, money, power, influence, controlling, bossy, salesperson, lots of money.
Yeah. So those are the same types of descriptors that my students come up with, because that's what we see on TV. That's what we read about, especially, if we think about in Washington, D.C., slick, like I think of the suits, right? And in fact, I'll let you know that I taught a legislative advocacy class for many, many years, and one of my former students is now teaching it. And many of my former students became lobbyists working for public health organizations, and they look like your typical public health person and they are often soft-spoken, and they're just very effective at building relationships, and they're advocating for public health policies. And so I try to kind of recreate the image of what lobbyists look like. And there are some of those that meet our descriptors, and then there's some that are much like us, just doing that kind of work. I'm going to talk a little bit about what lobbying is at the very end if there's time. But lobbyists if they're effective, they're building relationships, and they are going to be able to have influence because they have those relationships. And then, of course, we also can influence policymakers through media coverage, whether it's social media or traditional media, and just polls and public opinion and again, maybe what their constituents want. So this is just a partial list. I'm sure there's many other influences, but these are key ones that are relevant to our discussion today. When we're talking about advocacy, advocacy is really about building relationships with stakeholders. So it's not just for the lobbyists, it's really all of us in public health. It's building relationships with key decision makers. It's building relationships with law enforcement, building relationships with staff and departments of public safety. It's building relationships with each other and engaging our stakeholders and identifying supporters who are willing to engage and advocate in support of legislation. And so we'll talk about that again. There's lobbying, and then there's just getting information out there and building the momentum to create some of the environmental changes that we want. When we're talking about advocacy campaigns, these are 4 that I'd like to talk about. One is grassroots community organizing, which is going to be the primary focus of what we're talking about today. Coalition building, which has a long history in public health. And then I have a few slides because, again, I think these are important things, and I talk briefly about them in my classes, so I kept these slides. And if we run out of time, you can at least take a look at the slides after today's presentation. But those are all approaches that kind of complement each other in terms of a large overarching advocacy campaign. So the first poll that I have, poll number 1, is just, I'm curious, who's participated in any of these types of advocacy campaigns, part of a coalition, organizing campaign, lobbying effort, or media advocacy campaign, or nothing. Check all that apply.
We're at about 75% participated.
Okay, we'll just give like a 30-second or a few seconds if you haven't voted yet, or filled out the poll, if you could do that. A few more people are completing it. Okay, let's end the poll here. Rebecca, if you could share the results. So not surprisingly, 68% of all of you today have been part of a coalition. That doesn't surprise me because, again, that's a very frequently used method in public health or in a variety of different work that we are probably all interested in. 29% have been part of community organizing campaigns. Lobbying, again, probably not surprising, much less. And glad to see that 28% have been part of a media advocacy campaign. So those of you that have done some of this work along the way, if you you know, have something to add, you know, feel free to add it into the chat, or we can also potentially let you talk if you have something that you think is really critical to share. So I'm going to start talking first about grassroots community organizing. So really, it's really important that when we think about doing any type of advocacy work, that we think about collaboration. Problems are not going to be solved by one program, one policy, or a change at one institution. It's really going to take a large number. I shouldn't say large number. That sounds too frightening. It's going to take multiple changes at multiple levels to systematically drive down rates of problems. To create these multiple changes, it really requires multiple voices and skill sets. And as I said, we don't typically have tons of money in public health. We have people power or organizational power. And to build that power, we have to bring individuals together and organizations together. It's unlikely that one person or one organization is going to have enough influence to create any change, let alone changes in multiple levels and multiple targeted endpoints. So we need to figure out how to again mobilize and bring people together. So that collaboration is really, really important. I'd like to really emphasize this point that collaborations are incredibly important, but they are not the goal or the end point. Collaboration is a means to achieving a significant change. And I emphasize this because I've been around a long time and I've been parts of groups that like to meet and share with each other and feeling good, we're collaborating, right? But nothing happens to move forward to create the change that we're all hoping for. I've seen recommendations coming from NIH, you know, where it's like one of the things they say is, you know, reduce underage drinking. And one way they'll list a series of policy changes or strategies that could be used. And in that list, it will also be for like college campuses to have a task force. I was part of our university's task force for many, many years. And again, we just met and we didn't really create changes. And so it's keeping that in mind that it's not like a checkbox. Oh, I got my task force, or I got my team together. We're magically going to improve everything. It's really thinking about how do you bring those people or organizations together? How do you stay on track to move to action? And we're going to talk more about that as we work through these slides. But I want to open up poll number 2, just because I'm curious. How many of you like to be part of groups that only give reports to each other and really don't make any real change? So I think we can share at this point. We have a few more jumping in, but so the vast majority of all of you that are here today don't really like being part of something that doesn't create change. Now, it can be helpful to get together and share. I'm not saying you can't share, but sometimes we could just share by sending out an email update, right? If you actually have people, whether it's virtually or in person, but especially in person, drive someplace and take the time to go there. But even virtually, we're all on Zoom or on some other platform, virtual platform a lot, and we get tired and fatigued. If we're going to take the time to get together, it can be really frustrating to give up that time and feel like we're just doing the same thing over and over again. And at some point you might say, well, why do I keep attending? So if you're holding meetings and you're not figuring out how to move it forward, you probably risk having people drop out. I certainly drop out. Like if I find out something's not moving, I'm busy, I'm going to stop going. The best way to attract people to your work and to your campaign to join the cause is to be taking action. So it's really important that we're not sitting waiting for other people to join before we take action. By taking action, you're going to get other people to join your efforts. And you're going to keep and retain people because people want to feel good about their time, right? It's valuable time. So I'm really putting a challenge out to anyone here who is in charge of running meetings and groups of people, that you figure out how to help that group be successful in moving forward strategically to try to create change and celebrate those changes as they happen. So let's talk about grassroots community organizing or direct action community organizing. So one definition of grassroots community organizing is that people are brought together to act in their shared self-interest. So self-interest is a really key concept. So self-interest means, it could be kind of like what I value. It can be what drives me to do something. That's what I care about, what I have passionate about, that there's some reason for me to be involved. And the other key feature of grassroots community organizing is that the people who are directly affected by the problem take the action to solve it. So it's not about professionals coming in and solving everything for a group of people. It's about building the leadership among those people that are affected so that they can identify the solution to the problems they want to solve and take the action to solve it. So community organizing is about collective action. So again, bringing groups of individuals together to put pressure on key decision making. I put external pressure because that's really key. So when you're thinking about organizing and bringing individuals together, many would recommend not putting key decision makers, incorporating them into the decision making body of the group that you're organizing. Because again, they're influenced by a lot of different other organizations. It doesn't mean you don't talk with them. It doesn't mean you don't talk to the alcohol industry if you're working on alcohol control. It doesn't mean you don't reach out to others. It just means that you're having a group of people brought together that are going to be the decision makers for this work. And they're going to put pressure on, and it's external pressure so that it's not trying to put pressure on someone that's inside that inner circle. That inner circle plus their base of support is putting pressure on a decision maker. Sometimes those key decision makers are totally on board with you, and it's all great. And then sometimes you're going to have to figure out how do you exert more pressure to push them to make a decision that you want them to make. Community organizing is about being community driven. So again, the problems are identified by the community, and the solutions are driven by the community, and they should be appropriate for that community. So again, you have to think of that context. What is the problem that needs to be solved? What are the potential solution? Which solution is the best fit for that community or that population? Which solution is politically feasible? Which solution is just viable at that particular time? As I mentioned, the previous slide, it's about building leadership skills. So a really good community organizer, again, is identifying people in the community who have a self-interest to work on a given issue and working with them to give them the confidence and the skills to do the work, the advocacy work. So if you're doing a community organizing campaign and you're the organizer and you're the sole spokesperson for that effort, I would argue that you're not fully doing the community organizing work because you're not building that leadership, because the voices, you help it, you influence the messaging, but the voices should still be coming from the community. The work is also about being strategic and action oriented. So it's doing steps that are not just activities, but rather activities that are put together in a strategic way, moving towards some type of policy change. And the focus is really on taking power. And sometimes I see when I'm in person and I talk about let's seize the power, right? People get sometimes uncomfortable with that, right? But there's a lot of people that have power. The alcohol industry has power. A lot of the people with money have power. I'm talking about harnessing the energy of people to take back some of that power, to say these are the changes that this community wants and demanding those changes and using that collective power to influence the likelihood of the change coming about that they want. I also had mentioned that there's some recommended key steps or stages that are part of direct action organizing. These are the 6 steps that the Midwest Academy has used for many years, where people identify a problem, the organization turns the problem into an issue. So an issue that's solvable. So you might care about underage drinking and you may care about where kids are getting access to alcohol, and you find out that, oh, they're getting it at parties. Well, then a solution may be to have social host liability implemented in your community. And so then your group is going to develop a strategy to try to get social host policies in place. And so you're going to have to figure out step 4, which is bringing people together to face the decision maker. In this case, maybe the city council or alderman, the local level decision makers. You're going to present the case, the problem and the solution, at this, putting pressure on them to pass it. They're going to react. They're going to vote a certain way, and then you either have won, you regroup, or you go on to the next campaign. So that's one model. I'm going to talk about another model that I've been connected to as part of a few different projects, but you'll see that the stages are named something else, but they're very similar. So the first step is just assessing the community. What's the problem? What needs to be fixed? And looking at that specific community, building a base of support, finding the individuals that have the strongest self-interest to focus on that issue and the potential problem and solution or to help identify it, and who's going to not be necessarily part of the day-to-day decision making, but are there to lend support to build that pressure. You're going to continue to expand that base of support. The group that you bring together, that inner circle, I like to call them an action team. They develop the plan of action to figure out what is the plan to get the solution in place. And then they're going to implement the action plan. And then you're going to ideally maintain this ongoing effort, because again, underage drinking isn't going to be solved just by passing one social host policy. So how are you going to create ongoing effort and institutionalization to continue this work? And then ideally you would evaluate the efforts along the way. And both of these models look linear, but it's important to understand that you're often going back to earlier stages. You're continuing to do assessments, continuing to expand the base, identifying other people to come into that inner circle, that action team. And sometimes you have strategies and you try and they don't work, and then you regroup, and then you're going to have to think about other strategies to try to move your issue and propose policy solution forward. the role of the organizer in the community organizing efforts is so absolutely critical. That person should be adept at building relationships, be adept at conducting community assessments. Here I label it a strategy team. That's the other term that's often used. So an action team or a strategy team. So they identify those people that they think are going to be really passionate and effective at moving something forward. They're really good at building that leadership among the community members. And ultimately, they help the team be successful. They're in the background, helping to make sure that everything is moving forward. And they help the team be focused, action-oriented, and strategic. So they are, the organizer is really key in making it all happen, even if they may not be as visible to the public. So many years ago, there was a community organizer that in Minnesota that did a lot of work around tobacco control. And I got to know him, and he was just really soft-spoken, quiet man, and he was just so effective. And his team was very successful in getting some of the early smoke-free policies in place at the local level. And his team was being recognized at an event, and I was just kind of sitting in the background, and I was just watching him, and he was going over and he talked to this person here, and he talked to this person over here, and then this person and this person. And when his team got called up for the recognition, he didn't go up on the stage. It was his team that went up. And what I realized is he was doing that organizing work even at this recognition event, making sure that they all knew to go up, that they all knew what to say and felt comfortable doing that. And the spotlight wasn't on him, it was on his team. But it was clear if he hadn't done some of that work, they might have been fine at the recognition event, but it was very clear like how he does that organizing works and supported his team in the background. I want to stop. Are there questions that have come up for anyone so far before I go into my example?
Not seeing any in the Q&A, but if someone would like to pop one in quickly, I'd be happy to address it. Nothing so far.
Okay, then I'm going to keep going, but again, stop me if you have questions. So this is a project that I worked on years ago. So it's an older project. I'll be upfront about that. But I still use it because I think it's a really great example of a very straightforward yet complicated one-year community organizing campaign. So it was focusing on preventing illegal alcohol sales at community festivals. And it was a demonstration project. And so it's going to help me to kind of highlight some of these stages that I was just talking about. So it was called Changing Alcohol Policies at Events, or CAPE. And we randomly selected 4 communities that had community festivals. And keep in mind, those festivals are just, every community has it, right? It's a 1 or 2, maybe 3 or 4 day event where, there might be art booths and parades and rides for the kids. And oftentimes they also sell alcohol. And so we've just randomly selected 4 community festivals across that exist in 4 different communities. And we hired 2 community organizers. And so each organizer focused on 2 of these randomly selected festivals. When we talk about assessing a community, it can be a variety of things. It could be collecting data. It can be doing surveys of individuals, focus groups, community observations. And so that's one part of it, is collecting just what is the problem? What are the specific issues that might help address the problem that you're focusing on? There's also power mapping. And power mapping is understanding like who are the key decision makers, who has influence over those decision makers, what is the kind of the interconnection across kind of the power brokers or leaders in a community or in a state, and just kind of understanding those connections. And then there's something called one-on-ones. And I'm going to talk more about one-on-ones, but I do want to make the point with this particular project that we did collect data, but it was prior to this one-year organizing demonstration project. We had gone out and looked at the likelihood of illegal alcohol sales at community festivals across in Minnesota. And we found that 50% of the time they were likely to sell to someone that was underage without checking age identification, and 89% of the time they were selling to someone that looked obviously intoxicated. So both were illegal sales in Minnesota. And often we found that they were volunteers that were doing this service. And some of the volunteers were told, you know, your job is just to get as much alcohol out there as possible because it's a fundraiser. And so we knew that there was a problem with the likelihood of these illegal sales, but that was the only type of assessment that we had done ahead of time. So we hadn't done anything with power mapping. We hadn't done anything with these one-on-ones. So let's talk about what are one-on-ones. This is an absolute essential part of community organizing. These are conversations with individuals throughout the community. So at least in the beginning, the community organizer is going to set up meetings with a variety of people throughout a community or an institution or wherever you're doing that community organizing work. And it's not about just collecting data. It's not going out and doing an interview or doing a survey. It's having a conversation where information is shared back and forth. So you learn, the community organizer is going to learn about the concerns of the people they're talking about, you know, or what motivates them. What are they passionate about? What are they concerned about? What are their self-interests? So they may sit down with somebody and find out that they're really concerned about underage drinking because they have a 16-year-old and they're worried about the safety of that 16-year-old. Or they may, this came up with one of my colleagues, it might be someone who lives in Prospect Park where a lot of university undergraduates live, and maybe there's a lot of underage drinking parties, and maybe they have a baby and those underage drinking parties keep waking up the baby because they're so loud. And so they care about underage drinking because they want to get rid of those underage drinking parties in their neighborhood. A community organizer may learn that, you know, someone is like, well, my self-interest is that I own a bar. And so I care about kids, but I also care about whether my bar survives or not. And so it's really collecting information about individuals that you might put in a database and kind of say, okay, this person's a likely supporter, this person's not. But it's also the organizer explaining why they are meeting with that person. You know, what if they were funded to work on underage drinking, it would be up front, like to say, this is, you know, this is why we were funded to focus on underage drinking. And it's a two-way street. And so the idea is that there's some connection that is built. And then the organizer is also thinking, okay, this person might actively fight against this issue. Make note of it. This person might be a great person to be part of that action or strategy team, that inner circle. This person, maybe not for that action team, but maybe they're a part of that broader base of support. You can call on them to call on their city council member or to come to a city council meeting to show that there's really strong support for a given issue.
Tracy, we do have one question.
Yeah, great.
It says, how do you get policies passed if a good amount of the community doesn't see an issue, i.e. giving alcohol to kids before they leave to go to prom, or a prom send-off party is a huge issue in my area. So trying to get a social host law passed would be challenging.
Yeah, so it's a really great point. If with the organizing, you might only find 5 people that for your team that are passionate about this policy change, and you're gonna bring those 5 people or those 8 people together to work on it. And you're gonna have to think about, it may be a longer term campaign if you have to create quite a bit of change in your community. That's where some things like the media advocacy might come in to let people know about the problems that are occurring around that particular event, and broader concerns around underage drinking. It may be that you continue to go out and talk with people and do presentations to make sure that people are aware of what the problem is. And you're going to try to find those advocates within the city council or alderman's and see if you can find an advocate within that arena who will also put pressure on some of their other colleagues. And one thing that we haven't talked about yet is sometimes part of the organizing work is finding people to run for office that support the issues that you care about. And so within what's legal for within organizations, or what you do as a private citizen is, or run for your office yourself, is getting people in there that care about the issue. So I'm not saying it's always easy. It's just that you're going to have to continue to, again, think about what are strategies to shift the key decision makers, but also shift and continue to build that base of support. But the first step is just trying to find those that are with you right now and bring those people together and kind of do this ongoing work to expand that base of support.
Thank you, Tracy. We also have a quick question. Someone's very interested in that power mapping and wondered if you could share an example. They're not quite sure.
I think the example I'm going to get to will kind of help. Like you can literally, I don't have an example anymore, but it used to be like almost like a web, like here are all these people, and then you could draw lines to them. So literally you can create a visual diagram of like who this person is married to this person, and this person's, you know, best friend, and this person lives in this person's district. So you can do that kind of things. But I'm going to talk a little bit about some of the complexities of figuring out who the decision makers are with my community festival example. And it won't be at the diagram, but I think it'll illustrate some of that work.
Great. That's it.
Okay, terrific. So continuing on with the one-on-ones is that the recommendation is that you do 100 to 300 one-on-ones in the first 3 months of a community organizing campaign. And this can sound daunting, right? Like, so especially if you're a manager overseeing an organizer, you need to give the space to your organizer to say, I'm going to have coffee with 100 people, and say that's great, because that's about building those relationships. And it's, again, it's trying to find those people who do care about the issue. And if it's not supported throughout the community, it might be take some work to find those people that are going to have the self-interest to do the work that it takes to try to push something like the social host forward. So you start out by maybe meeting with some people that you know, and don't assume because you've talked to them about a different issue that you know where they stand on this particular issue. It's like also when you're doing an assessment, like I was curious about billboards in my own area. And I was like, oh, I think there's billboards, but we drove around and it was like, oh, actually there aren't billboards, because I didn't really pay attention. So when you're working on a new issue, you want to look with kind of take through a fresh filter, right? To say, I'm going to look around and collect information specific to this new thing that I'm talking about. And if I meet with individuals that I already know, I'm not going to make assumptions about what they think about this particular problem or issue. And you might also meet with key leaders. You know, maybe it's the head of the local health department. Maybe it's going to be the principal of the elementary school, or it's going to be the police chief. There's key decision makers, right, that you might start to meet with. And at the end of the meeting, you're going to say, who else should I be meeting with? And typically when you start getting referred to the same people is when you're kind of know that you're done with that kind of first level of doing one-on-ones. And again, through these one-on-ones, you're going to be building these relationships. You're going to identify your supporters and your opponents, or the ones that are just kind of neutral that you might have to try to figure out how to move forward if you're trying to expand your base of support. Now you might say, well, is this really feasible? So as I said, we had 1 year to do this CAPE project. And in one one of my community organizers left the project after 2 months. Complicated story. The person didn't really want the job, but took it and then moved on. And so one of my community organizers actually only had 10 months instead of 12 months. And they went out and they did one-on-ones, either through phone calls, door knocking, or setting up coffee or just a meeting one-on-one. And so if you look across these 4 communities, one we labeled urban, one was rural, one was new suburb, one was an older suburb. You can see in the older suburb, that organizer completed 300 one-on-one contacts. In the rural area, over 200. In the urban and the suburban, it was 100 to about 175 or 80 or something in that range. So they did that within the first couple months. Now, the community festival is an interesting focal point because it's a specific geographic area. And so they did a lot of door knocking right around the community festival because those are the people most likely affected by people getting drunk and getting in fights or urinating in their yard or causing some type of property damage or other disruption. And they also, again, met with community leaders and festival planners and a variety of different people in each of the communities. Through those contacts, they were building awareness because, again, during those one-on-ones, they're sharing information about the community festival. We had the data that says, look at, kids can easily purchase alcohol at these festivals. They're over-serving alcohol, and that's why maybe people are peeing in your yard if that's what they cared about. And so it was just making people aware of this problem and identifying those people who cared about the issue. And then the organizers started to build their team. And when you're building your action team or your strategy team, it's not sending out an email or a flyer saying who's interested. This is much more strategic than that. This is, after those one-on-ones, you've identified those people the organizer has identified those people that they think are really important, that they really care about this issue and have the skills and the motivation to move it forward. So again, the inner circle, making decisions and figuring out the strategy. And you've hopefully through that one-on-one made that contact and started to build that relationship. Because I tell you, if someone sends me an email out saying, oh, this is happening, even if I really care about it, I'm really busy, I got a lot going, really into pickleball at the moment, I'll tell you, and if I had to choose a pickleball game or go to some type of meeting that I don't know what's happening, I'm probably right now going to choose pickleball. But if I've met with somebody and they've started to build a connection with me and they contact me and they say, Tracy, you were saying something that was so important to this issue. Your understanding of underage drinking is so critical to the work that we're doing. And I can't imagine us moving forward if you're not there. Please, do you have the time to join this? We're going to make a difference. If someone says that to me, that I know and I've had a conversation with, I'm probably going to show up. So being strategic in who you invite and how you invite them to be part of this team. So you're going to build that team. Again, you're going to continue to identify the people that are going to be there to support the team as needed. This was one of the teams for one of the communities focusing on the festival, by the way. So that team tends to be small. I'd say like 6 to 10 people. Then the team will put together that action plan that's going to be specific to that community with a policy focus or enforcement focus or, changing the environment. And it's going to be strategic. It's how are we going to get something changed in our community? And we had ideas, by the way. So I've worked with some people who are kind of purists in terms of community organizing, and they'll say, well, we're not going to share ideas. That's the work of the community. I personally think if we have some information out there about what might work, why wouldn't we share that? Doesn't say what you need to do. It doesn't say that there aren't other possible solutions. It's just saying here are some ideas that some people have identified. So we identified potential categories of policy changes for underage sales and social provision, preventing intoxication, management issues, protecting the community. So we had policy recommendations that we shared, and these policies could be implemented at multiple levels. So now kind of think about the power mapping question, right? So when you're thinking about something like the community festivals, it's looking at who are the decision makers. So at a festival, the alcohol providers are often controlling the booth level. And so they may make decisions of who's serving the alcohol, who gets training, who doesn't get training. Then there are decision makers at the festival level. The decisions that are made at the festival level affect all the alcohol providers at the festival. And then there's community level, and the community level can make decisions about temporary licenses, which is what community festivals have that are selling alcohol. They have a temporary license. So at the community level, if there's a policy change, it's likely to affect all of the events that have temporary licenses in a community. And so there are different decision makers at each of these levels, and they're influenced by different people, and they have different self-interests and different concerns. And that played out differently across those 4 communities, which I'll talk about. So what happened in these 4 communities? So with 10 months to 12 months across the 4 communities, our organizers and their teams were able to change policies in all 4 communities. For one of the festivals, the change happened at the festival level, and at 3 of the communities, it changed at the community level. So at the festival level, part of it was that those decision makers at the festival level, they were all attorneys, and they had problems in the past, and they were concerned about liability issues. So when the organizer and the team were meeting with these decision makers at different levels, they quickly found out that these festival planners, they got it. They wanted to put more in place to prevent problems from occurring because they were concerned about liability. So they could work with those festival planners, get the policies in place. At the other level, in one community, the booth level were really interested in making some policy changes. And so they started working at the booth level, but at the same time, they were also looking at the community level. And another community, they met with the festival planners, and they initially said they were on board. And if the team had only continued to work with the festival planners, who then just kind of killed everything, stopped everything, nothing would have happened. But simultaneously, they were recognizing that there were other key decision makers that were interested about temporary liquor licenses at the community level. And so they continued to have strategies that kind of focused on multiple levels, multiple decision makers. And so ultimately, it kind of fell apart at the festival decision maker level, but they were able to get something passed at the city council level. So again, it's looking, who are those decision makers? Who are with you? Who are not? And by the way, in one community, they initially said they were going to vote for something, then did 180-degree turn and said that they weren't going to support. There was some pressure from the team and the community and some media coverage. And then ultimately the community, the city council changed and put the policies into place. So key to the success of this work was that there was local media coverage. The organizers worked with the team members to do the media work. So they did training on how to do the media work. They helped with the messaging, but ultimately the public face of the teams were the team members who were from the communities. They had very community specific solutions. So again, kind of like who was on board and who wasn't, what specific policies to control alcohol sales at the events kind of varied from kind of the list of things that we had recommended. There was leadership development and really active involvement of team members. So the team members did the talking with city council members, the vendors, and the festival planners, kind of post one-on-ones. They did the presentations to the city councils. Again, the community organizers helped them put together the presentations and help them practice, but it was the team members who did it. The team members chaired the meetings. They took the meetings, the scheduling of the rooms, drafting media announcements, etc. The organizer would call them in between meetings and say, at the last meeting, one of the action items was that you were going to do this. Do you need any help getting that done? And so then the organizer helps keep things on track and supported them and helped them be successful doing the work. Some of the challenges we faced is that the committees were randomly selected. So it wasn't like a situation where there were known problems around these festivals and thus could kind of go in knowing that there was some level of support for changes. So the organizers had to go in again and identify those people and kind of just say, we're going to try to prevent those problems from occurring. And selling prevention is sometimes harder than going in and trying to address problems that people can see. Again, we had 1 year, so we couldn't make observations about whether the policy changes resulted in a decreased likelihood of sales. And if we had another year, we could have done that and then fed into maybe looking at implementation of the policies. And so I don't think they really got to the enforcement or full implementation of the policies within that year. Some challenges for doing community organizing work is providing sufficient time for those one-on-ones, that relationship building, maintaining engagement of the core team members and bases of support, building leadership, and avoiding burnout. So if you continue to do this work month after month, year after year, it's always looking for who are kind of the new leaders that are going to step in, as some people burn out and need to stop or take less of a leadership role. Some things to consider if you're doing an organizing campaign. Should you yourself serve as the organizer? I often say, I believe in organizing. There's some things I could do well as an organizer. And then there's some parts of my personality is like, I'm okay with some conflict, but in general, there might be other people that would be better at some of the conflict that might come up around some of this political work. So I'm a really good supervisor or manager of organizers. The qualities of an organizer, personality, good humor, good sense of humor is really important. Good people person, good team member. Whether they should be from the community is debatable. I think being able to build strong relationships within a community is most critical, and having experience ideally would be really important. I could teach someone content. It's hard to teach someone to have the instincts of a community organizer. So keep that in mind. If you're hiring an organizer, that it's okay if they don't know alcohol control policy. Give them some articles and some books and they can learn that. If they come from an organizing background, I would give preference to that. Make sure you give organizational support to the organizer, really looking at that leadership development. Again, it's not about doing busy work. Oh, we're doing this and we're doing that, we're doing that. It's like we're doing this to move to this, to move to this, to move to this. Your teams and your organizers should be able to articulate why they're doing these activities, why they think it's going to help in the progression towards a real change. And then finally, there's some question about agenda-based organizing versus bottom-up approaches. Agenda-based organizing is when you're funded to work on underage drinking. Then be clear right up front. This is what we're funded to do. This is why we're doing this. In the purest form of community organizing, you would give funding to a community and they're going to identify whether it's underage drinking, cannabis, opioids, violence, and then generate solutions. I would say oftentimes in public health, we do agenda-based organizing because our funding often works that way, but at least be upfront about it. I'm just going to let this, I included this for my class because they have to develop a budget and implementation plan, just some things to think about if you're building an organizing campaign and what you should think about with your implementation plan and budget. The Midwest Academy does do community organizing training, so that is at least one place to look if you need to send someone out for training or training for yourself. I'm going to just take a breath for a second. Any wrap-up questions around organizing before I do a quick piece about coalition building to kind of show the contrast with organizing?
I'm not seeing any in the Q&A.
Okay.
Take your breath.
I'm going to take my breath. I took my sip of water.
Well, wait a minute. Here comes one.
Great.
How do you delegate? Is Stephanie wants to know, how do you delegate?
So if you're the organizer, how do you delegate to one of your team members to schedule a room, for example? I think it's like anytime you're doing management work, you just say, this is your project. I'm here to support you. We need someone who can book the room. We need someone to take minutes. And you look and you pause, wait, or talk to someone ahead of time and say, are you willing to do this? Because it's really important that the community take ownership of this work. I will be there as the organizer to support you because I'm being paid to do that. But it's really about making sure that it's driven by all of you in the community, and then helping them succeed, reminding them that they said to do that, asking them how they need help to do it.
And one other quick question is, how do you engage folks after the one-on-ones?
Yeah, so really good question. So some of the engagement is going to be with those that you invite to be part of the team, with kind of that broader base of support. Maybe you send out regular updates to them, calls to action. Maybe you or one of your team members swings back to some of the people that showed more interest to engage where they are now, letting them know that what happens. But certainly you want to think about ways to stay connected with them and let them know when something is happening, whether it's an event or something's happening at the city council, asking them, inviting them directly to be part of that effort at various points along the way to stay engaged.
Thank you. That's it for now.
Okay, let's talk about coalition building. I know many of you said you were part of the coalitions and have been part of it. With community organizing, as I mentioned, that's kind of bringing individuals together. With coalitions, we're usually talking about an organization of organizations coming together to work on a common goal. Sometimes it's just coming together to work on one policy issue, and sometimes it could be a coalition exists for 10 or 20 years, continuing to work on multiple issues and policy outcomes. We build coalitions because usually one organization can't win alone. It increases the resources that are put towards an advocacy campaign. It increases the impact of individual organizations' efforts. And especially this is important when we're talking about state level change or federal level changes, that it broadens our geographic scope. So we have more we have connections to a greater number of elected officials representing different geographic areas. Some considerations that I think are important when developing coalitions is identifying organizations that have this shared interests, that they come together to choose this common issue. If possible, it would be great to have neutral staff so that one organization doesn't have more influence than others because it's their staff person. Sometimes that's possible, sometimes not. I think it's important that coalition members agree to disagree. They focus on common goals, but there might be some things that they don't agree on that are outside of the work of the coalition. And it's going to be really important to figure out how to make decisions. So is it consensus based? Does everyone have to be in agreement, or is it going to be a 50% plus one of the people who are present? If there's a quorum, what is the quorum? So if it's really clear up front how the decisions are going to be made, everyone can buy into that decision, the decisions that are made, and hopefully that helps the coalition from getting stuck, not being able to move forward because they're not making some kind of decision. That was an extra slide, sorry about that. A challenge of coalition work is that I often have seen some coalitions fail to take action. So I've been part of coalitions that say, well, we're going to take action when we get this organization onto the coalition, or when we get this elected official on board. And first of all, maybe the elected official shouldn't be part of the coalition, because again, you want to put external pressure on decision makers. But it's also, again, like the organizations that are there can try to think about what actions they can take. And if they're showing movement, it may make other organizations want to join the coalition. So moving forward with in the organizing with the individuals that you've identified, same with the coalition, even if it's just a few organizations that are together working on an issue, how are you going to kind of start to push things forward, whether it's with media advocacy or just meeting with elected officials, and then letting other organizations know the success and movement that you're taking and inviting them again to join the work that you're doing. Some of the challenges I'm sure some of you have run into is that it may distract from your organization's other work if you get fully drawn into a coalition. If you're part of a coalition, you may be passionate, your organization wants to really, put something really strong in place, and the rest of the coalition members aren't willing to push for that strong of a change. And so your organization may have to support something that's a little weaker than what you would have worked on your own. And of course, if the coalition is out front, the coalition will probably get credit for some of the work in your organization that maybe did a lot of work on this issue may not get the credit. And so that's something that I think organizations have to reconcile. These are some key ingredients, I think, for a successful planning of a coalition, including, how much effort for the director, time for building the coalition, et cetera. Again, I just kept it in. I use it for my students, but in case it's useful, I left that in. Some considerations for both coalitions and organizing, again, I'm going to really emphasize is being action oriented. So going back to my poll, most of you don't want to go to meetings where nothing happens. And so with these coalitions, I think it's just very easy to get together and say, well, this is what my organization is doing. This is what I'm part of a group right now that's doing this sometimes, right? We spend so much time hearing about what the other organizations are doing. It can be useful, but it may not be that critical for the coalition work to move forward. And again, maybe it could be an update in an email. Maybe it's just 5 minutes at the end. The bulk of the meeting time should be what do we need to do? Who needs to meet with whom? How do we get a lobbyist on board? How do we, what is the messaging that we're going to use? How are we going to pre-test the messaging to see if it's effective with key decision makers or with the general public to get them to buy in to this issue that we're focusing on? So it's thinking of the activities, is the delegation, who's, at the end of the meeting, what are the things that we decided to do before the next meeting, and who's should be responsible and held accountable for getting it done before the next meeting. So again, not just activities, but strategic actions that move towards your goal. And sometimes you're going to hit a dead end, you're going to come back and you're going to start over, but it's always trying to think about how to move towards that change. I think actually, no, this next one. I also will challenge all of you doing this work to, if you're going to spend all this time building a coalition or doing community organizing work, that you don't waste time on interventions that do not work. So I'm going to bring up DARE. DARE has been around forever. There's not a lot of evidence that DARE works. So I wouldn't spend a lot of that valuable time trying to figure out how to get DARE in your schools. Look for something that at least is promising or has been shown to be effective. And it's going to be effective at the population level. If you're going to bring together all this collective organizational or individual power, use that power to create change that affects a whole population. So let's do poll number 3 now, which is, since my challenge is to do something that's effective, how many of you feel like you know where to find information about which strategies are most promising to address the problems you're working on? So let's share these results. So of those that participated in the poll, just over half feel like they know where to go. That means almost half are not sure or don't know. And so I think that there's work for me as a researcher. I think for training centers in federal government, we have to do a better job of trying to get information out there and sources. Like I've mentioned the community guide, the last two presentations, just do a search on community guide and you'll find recommendations on alcohol control policies, but also a variety of tobacco control, drinking and driving, a whole range of topics. They do get dated. The last review for alcohol control was 2010. So that's a challenge. But we need to seek out, at least search for those type of places that do systematic reviews, because that can provide some guidance. And then those of us that control some of access to information from the research side, we all have to continue to work to do better, I think, to get information to people so they know where to look. And we have to be able to say, this strategy really does not look promising. Put your energy someplace else to provide better guidance. I think we all get a little bit hesitant to do that. And we have to, I think, challenge ourselves to do better because time is precious and financial resources are very precious and we should use them as well as we can. So thank you for doing that poll. This is again reiterating something I've said a few times, which is moving towards action. This is adapted from Aristotle. Talk alone moves nothing, only talk that is tied to action can do so. So we can talk a lot to each other, but if we don't take action, we're not going to create the change to meet our goal of improving the health of our communities and populations we're working with. So that's a pretty quick overview of community organizing, a quick snapshot of coalitions and trying to push coalitions, I think, to be even more effective. I mentioned that I had a few slides focusing on lobbying and media advocacy, and I just have a few minutes left, so I'm going to cover them. One definition of lobbying is carrying on propaganda or otherwise attempting to influence legislation. And as we already talked about, what we picture is kind of on the left. And in reality, in public health, there's many lobbyists that are really doing important work and trying to change public health policies or health-related policies. With lobbying, again, it's about building relationships with elected officials and administrators or staff members at various policy-making levels. And it's becoming a resource for decision makers. And really, the emphasis is really on providing accurate information. That relationship is so valuable. It's meeting with them regularly. They understand that you have some expertise. So if they know that I'm an expert on underage drinking, then there's a vote coming up about a policy focusing on underage drinking, they might call me up and say, well, Tracy, this is what the policy is. Do you think I should support it or not support it? They might do that to me as a researcher, but if I was a lobbyist, they might do that, right? And I'm going to provide them the most accurate information I have and say, yes, I think you should support it, or no, and this is why or why not. I've heard people say you get one lie, and if you lie and they catch it, you're done. And that happened with one of the alcohol lobbyists in Minnesota many years ago. I will tell you, he misled a lot, but he got caught once, and it was like the next day he was gone and working someplace else. So that ability to build a connection or relationship is going to be really important. And then following through, getting the information to them quickly, because time is very critical for decision makers usually, and that you can provide as accurate information as you can in a timely way. A lobbyist is also a strategist typically, so they understand how a bill gets introduced or a policy proposal gets introduced, understands the system, whether it's the city council, whether it's the state legislature or Congress. They understand the policymaking process, the rules, ways of maneuvering around the rules, and understand how to influence decision makers. and how to work with staff. You have staff influence decision makers because they're really good at building relationships. I used to match my students with a professional lobbyist who's just really a wonderful human being, really great mentor to many of my students. And my students would tell me that everybody knows him. When they follow him around the Capitol, everyone, the person sweeping the floors, everyone knows him, and he is kind and friendly with every single person because he's very good at building relationships and very strategic and knows how to move a bill through the state process. And keep in mind that a lobbyist can be executive director of a small nonprofit. It can be a staff person at a nonprofit organization, it can be a volunteer. Like I helped create a citizen action group. And so my co-developer was a citizen lobbyist. He registered as a lobbyist and was a volunteer. And then we have the contract lobbyists, and some of them might meet the stereotypical image, but many of them, again, are working on education or public health issues and probably don't look like what you're picturing in your mind when you think of a lobbyist. There are two types of lobbying: direct lobbying, which is direct communication with any member or employee of a legislative body and any government official who may participate in formulation of legislation. This is not education. This is not going in and talking about an issue or a general idea of how to address underage drinking. This is when there is a specific policy drafted. There's a bill number, and you go in and you say, please support bill number, blah, blah, blah. Please vote for bill number, whatever. That is direct lobbying. Very distinct from education about an issue. Grassroots lobbying is if I am the head of an organization, I have members, and I send out a message to my members and I say, please call your legislator or your city council member and ask them to vote yes or vote no on a specific piece of legislation. That is also lobbying, the grassroots lobbying. And if you have a 501c3, these are things that you need to track and understand. And it's really important that you understand what is lobbying and what is education and what the line is, because you don't want to go over the line, but you might be able to go up to the line in a very legal and appropriate way. So that's really important. And my fourth poll is, do you know where to go to find, and I don't have the answer, I'm just doing this because we're part of a training, and so some people may be able to help you find the answer, which is, do you know how to find help in figuring out what is allowable in terms of lobbying? So just a matter of time where I'm going to share the results now, even though not everyone has participated, but of those who did complete the poll, a little over half do know, but that means just under half don't know or aren't sure. I think that's really important information that we can try to get out to organizations so that you know what is allowable from a funding perspective, as well as from a nonprofit status. And there's a certain amount of lobbying that is allowed depending on your funding source. And again, knowing what is education versus what is lobbying. Okay.
Tracy,
yeah.
We did have one question.
Yep.
Do you want to take it now?
Let me do these slides and then yes, I'll take it real quick. Just the other thing I wanted to mention is media advocacy. The story will be told with or without you, so take the opportunity to take shape. Decision makers, elected officials, do pay attention to media, whether it's social media or traditional media. So just take a look at these couple slides, or just some ideas for how to influence the agenda. How do you move your issue higher up on the agenda? The media is one way to move it higher up on the agenda, to make it like, we need to address this issue. I will say too that it's always sad to me when I hear of a story of a tragedy that occurs with often with underage drinking. Going back to the question about how do we get people to pay attention, if there is an unfortunate tragedy, doing media advocacy to make people aware of, like, where did they get the alcohol? What are some things we could have done to maybe prevent this from occurring, to draw people's attention to it, to move it up on the agenda? I certainly hope we don't have many of these tragedies, but unfortunately we still do. And we need to make sure that people are aware that these are preventable things from occurring. And finally, I'll answer that question now, and people can take a look at my website, but I'm going to stop sharing. What was the question?
The question was, what do you do if youth themselves, the target audience, suggest scare tactics? Ooh, they like the mock car
They
crash.
do. Yeah, I think it's really important that they understand, to let them know, like to have them share their ideas and say, that might grab some attention, but we know that it just grabs people's attention for a short amount of time. And what we really want to do is keep young people safe. So we need to do some other things. And so maybe help acknowledge why they might want to do that, but then help educate them, let them know that we've tried that and we value their opinion, but we also want to bring them into making something that's going to be effective. And with the scare tactics, we also know in the research, like if we give a scare tactic, we have to give some kind of solution for people. So that's the other thing. If you do use the scare tactic, make sure it's tied to some other solution so people don't just shut down and don't pay attention.
Well, thank you so much. I'm excited. I'm going to share a few slides here too, but thank you for the information. It's been helpful, and we're going to just end with some things that are coming up. The Great Lakes PTTC has trainings coming up, one about putting the engage back in engagement on October 27th. Another on harnessing the power of humor in facilitation. And we're going to do a data series looking at developing capacity to gather local data, overcoming mistrust in rural communities, and overcoming parents and schools' resistance to school surveys. We invite you to follow us on Facebook and like us. That's helpful, and it's another place where you can get information about what's happening and other resources. And then finally, we will, you should be redirected, but in case you want to act on your own, here is the link to our evaluation survey or the QR code, but know that we will follow up with you and you should be redirected. And that's it. We are right at the end of our time together. I want to thank everyone for being here, and we will be sending out certificates of attendance at the end within 2 weeks to your email addresses. Thank you, Tracy.
Thank you.